Hi, very good morning. I'm Dr. Janak Patel, MD, General Physician. All my video lectures are mainly for educative purpose. In continuity with the previous lectures in neurology, this is one of the lecture which I'll be trying to make it as simple as possible, different terminology used during eyeball movement, what are the different eye muscles, how they act, etc. It will be animated videos which I have collected from YouTube, and I am very thankful to the person who has uploaded that video. I am utilizing for education purpose only. So we'll be talking on those particular terminology and we'll be showing you different videos. So extraocular muscles are the muscles which will move the eyeball. So there are 4 recti and 2 oblique muscles: superior rectus, inferior rectus, medial rectus, lateral rectus, and we have got 2 obliques, that is superior oblique, inferior oblique, and they move the eyeball in different directions. We'll be dealing with all those. So extraocular muscle, what are those muscles, what are the actions, and what are the different terminology which are being utilized to mention the action of those muscles. So we'll be dealing with that particular and we'll be showing you the videos also. Now you can see here, if you cover one eye and if you look at the movement of one eye, that is called monocular movements, movement of one eyeball. And when you remove this and you see the movements, that will be binocular and we call conjugated movements. First I'll be talking of a monocular movements. Say a medial rectus of this eye. This eye is right eye of a person. So when it moves medially, medial rectus is working. So medial rectus will move medially, we call adduction. And as it is towards medial, it is also called medial movement, or we use a word inward, nasal. When lateral rectus is working, we use the word abduction or temporal movement or lateral movement or outward movement. So there are 4 words: temporal, abduction, outwards and lateral. While medial rectus will be inward, adduction, nasal and medial. While downward movement is also called inferior or depression, or you can call downward, introduction and depression. While upward movement or elevation or superior or superduction. These are the different terms which are being utilized. You can use any one of them, those. Along with this upward, downward, adduction and abduction, there is a rotation of the eyeball. That is called extorsion and intorsion. Meaning of intorsion means eyeball is rotated towards the medial side. And when eyeball is rotated outwards, it is called extorsion. The another word which is being utilized for that is excycloversion and encycloversion. So these are the terms. Now if we go through the movement of medial rectus and lateral rectus, medial rectus is pure adduction, lateral rectus is pure abduction, but superior rectus will have elevation plus adduction, while inferior rectus will be downwards and adduction, while inferior oblique will have elevation, abduction and extorsion. So these three movements will be there by inferior oblique. While superior oblique will have downward movement, intorsion and abduction. So there will be three movement of superior oblique, as well as superior rectus will also take part in intorsion and inferior rectus will take part in extorsion. So putting together, adduction will be done by superior rectus, inferior rectus and medial rectus, while lateral movement, or we call abduction movement, will be done by mainly by lateral rectus and partly by inferior oblique and superior oblique. Elevation will be done by superior rectus as well as inferior oblique, while downward movement will be done by superior oblique and inferior rectus. Extorsion will be done by inferior oblique and inferior rectus, while intorsion will be done by superior oblique and superior rectus. So these are the permutation combination of different eyeball movement and terminology which are being utilized. And we have mentioned the action of muscles. Now to understand that action of muscles, we'll be showing you some of the slides. Now when you remove this particular cover and you ask the person to look medially, laterally, upward, downwards, and then we combine the angles, that is upward and outwards, downwards and outwards, upward and medially, downwards and medially. There are group of muscles which will be working together of right eye as well as left eye. And the terminology utilized is same: abduction, adduction, intorsion, extorsion. Then there is a word utilized is divergence and convergence. Means when the two eyeball, medial rectus, both medial rectus are working, we call convergence, and when they go away, we call divergence. Also, the word utilized is excycloversion and encyclovergence. And also, you use a word during rotation, version. There is one another word utilized is dextro and levo. Dextro means moving to the right side, levo means moving towards the left side. So dextroversion, levoversion, and excyclo and encycloversion. These are the some of the superior, superduction, infroduction, superversion, infroversion. These are the some of the terms which are being commonly utilized. And you can combine excyclotorsion and entorsion, encyclotorsion, dextrocyclo and levocyclo. Now we'll be going through this particular video. Just pay attention, and these are some of the terminology which will be utilized. Sorry, I will have to go through